The effectiveness of conservative treatments for idiopathic scoliosis has been a subject of ongoing research and debate in the medical community. Traditional symmetric exercises, such as those based on the Milwaukee method without self-correction, have not shown strong evidence of effectiveness. However, physiotherapy exercises have emerged as a significant treatment approach, with their effectiveness rated at level 1B according to the Oxford Centre for Evidence-Based Medicine. Current therapeutic approaches predominantly utilize asymmetric corrective exercises, which focus on self-correction of vertebral column positioning in all three planes. Some treatment protocols also incorporate symmetric mobilizing exercises to improve spinal flexibility and correct lordosis and kyphosis formation. Recent evidence suggests that supervised exercise programs can reduce the incidence of curve progression in children with idiopathic scoliosis. However, the Scientific Society on Scoliosis, Orthopedic Rehabilitation and Treatment notes that evidence supporting conservative treatment effectiveness remains limited, particularly regarding the isolated effects of specific therapeutic exercises. This has led to ongoing research efforts to establish more definitive evidence for various treatment approaches. Despite initial skepticism, systematic reviews have consistently shown that specific exercise programs can improve cob angles, strength, mobility, and balance in individuals with adolescent idiopathic scoliosis. These findings represent a significant shift from earlier perspectives that considered general exercises ineffective for treating scoliosis. The therapeutic techniques used for idiopathic scoliosis treatment can be categorized into the following main approaches. 1. Asymmetric corrective exercises. Focus on self-correction of vertebral column positioning in all three planes. The asymmetric corrective exercises include Schroth exercises, which integrate breathing methods and target inactive muscles through three-dimensional spinal deformity correction, and include corrective positioning that patients maintain during daily activities. 2. Symmetric mobilizing exercises, aimed at improving spinal flexibility in the sagittal plane, helping correct the formation of lumbar lordosis and thoracic kyphosis. 3. Specialized methodologies, scientific exercises, approach to scoliosis, and Barcelona. Scoliosis, Physical Therapy School have shown effectiveness in preventing scoliosis progression. The Schroth method has received the most research attention and uniquely demonstrates significant reduction in spinal axial rotation. Modern programs often incorporate 1. Aerobic conditioning through stationary cycling, 2. Lumbopelvic stabilization exercises, 3. Isometric exercises for spinal segment stabilization. The treatment protocols must include 1. Standard supervised protocol, 2. 3 supervised sessions per week for 10 weeks. 3. Additional traditional exercises assigned for home practice. 4. Both Schroth and core stabilization groups followed this schedule. 5. Daily exercises, 7 days per week for 12 weeks. 6. Available in both supervised and home-based formats. 7. Regular monitoring of body rotation and surface asymmetry. 8. Long-term management protocol to verify exercise quality and update objectives. 9. Specialized aerobic training component including 30-minute sessions on cycloergometer to maintain or improve pulmonary function. The Schroth method is a specialized, non-surgical, exercise-based approach designed to treat scoliosis, particularly idiopathic scoliosis. It was developed by Katharina Schroth in the 1920s and has since been refined and adapted. The method focuses on correcting spinal alignment, improving posture, and stabilizing the spine through a combination of exercises tailored to the individual's unique curvature pattern. Key principles of the Schroth method are 1. Three-dimensional correction of the spine, as the method addresses scoliosis in 3 dimensions. Side-to-side curvature is addressed in frontal plane. Excessive or reduced kyphosis and lordosis in the sagittal plane. Vertebral rotation is addressed in the transverse plane. In fact, the Schroth method aims to derotate, elongate, and stabilize the spine. 2. Emphasis is placed on strengthening the weaker, elongated muscles on the convex side of the curve and relaxing the overactive muscles on the concave side. 3. Breathing techniques, Rotational angular breathing is a core component of the Schroth method. Patients are taught to direct their breath into the collapsed areas of the rib cage to expand the concavities and correct rib deformities. 4. Postural awareness. Patients learn to maintain corrected posture during daily activities through proprioceptive training and mindfulness.